Yes, infection control program akongko. Cecil, back. Okay. Okay. Sigi ahamba kanose standard precautions se. See, every kanona havadi every staff haitare. Right from patient care, low riba, nursing staff tagi, hauraga, doctors, see dum tip talaibam to ever sigi kanose. What are standard precautions haragadi? Sigi 5 components, especially hand hygiene ne, personal protective equipments natraga, personal protections sigi definition je nangi area of what area what nang thabak tori pham samna have the pharmacist amagi personal protective equipments natraga aduga lab ta work tori siga OPD da work to resiga, laboratory da work to resiga, ICU da work to resiga, personal protection ding ataneba, but definition ju very tawaneba, magi ko. Instrument processing, whatever akone use or instrument say, fazana use to ding asu sterilize to ba use to matung da su kamaina disinfect to sterilize to thamgadage have never ko. Environmental control. So there is the basically environmental control the you see mixing up of infected, non-infected say taudanaba so that infection spread taudanaba. Number one. Number two, concept of isolation ward. Highly infectious person di tungana general ward tagi thaminadaba. Layout the hospital building da magi patient give movement se infection we infectious weba kano siga patient siga general public ka magi layout sida movement da mix up risk cost of donum su tawdavni duga last biomedical waste management akoina generator riba waste se general waste ka compare to gadi yamde but akoida natraga laiba patient da harm to ba akoina proper segregation taudraba duga store taudraba natraga transport taudragadi akoida natraga patient da harm taudunina sigi idea phajana laiba phaiba sisina basis neba pillars of akoi infection prevention control se next slide Cecil next slide Cecil okay thank you Sidesida akoina area of concern kanosida infection si akoigi kai matangi no harakanda akoina infection control protocols ta adhere tौनबगी कोई to do list to man yeng be ba kai da bai tok do no har kanda ji aina panjagi bado koi ahamba patient la pasida akuna koi main aim di first do no harm neba moi di no da lak chai ni treatment am phang ba lak chai ni at the same time akoi gi su kano su hai tare koi akoi gi housekeeping staff multitasking staff ju moi ju service am tawla ineba sigi environment isamak su hai tare sidai sida entire akona environment se fazana control da maintain tarogadi koi sa maksu protect taroga harm toroiduneba ona sigi khuna iriba presentation ma'am si IMEP hagadi infection management and environment plant biomedical rules ni which is change dum tawlai 2008 16 hujikti 18 and 19 julai reco amendment adu soi palakke aduga hujikki an training yoy sa ju khangani NQAS की main component से breakup तौरगदी कोईना structure process and outcome नेबा अदुना सिगी infection control से outcome process की part अमोइना चिंगी नेबा Cecil next slide अदुना कोईगी area of कनोदा कोईना health center work तो वही मतुगिना standard का measurable element का खेनेयेबा district hospital ga CIC ga di taruk taruk aduga PSC ga su taruk UPSC hari aduga dana manga ne ba sigi makhada measurable element pulapna kumathoi yawi PSC and sorry CIC and district hospital PSC na trangani UPSC tara aduga dana mapan ko next slide please Sigi sidana standard akoi sidai taruk piri sidi koi kano gineba CIC ka district hospital ni na aina check to matamda the yaudri se F5 se environmental control se yaude otherwise F1 infection control programs katang matiam yaure hand hygiene 2 personal protection instrument process and autoclaving plus biomedical waste management neba. Next slide please. Sidesida Ahambada facility has infection control programs and procedure in place for prevention and measurement of hospital acquired infection never. See part C the yog diaboko. Next slide please. Sidesida ME measurable element F1 the infection control committee, infection surveillance, hospital acquired infection surveillance. Sigi rate say see mention tau day. Next please. Duga Sidadi Yaure. Facility has infection control program and procedure in place for prevention and measurement of hospital acquired infection. The MEF 1.4 staff immunization day. There is provision for periodic medical checkup and immunization of staff. Sidesida aina panjakib se hana register ama maintain tauraga magi staff to gi immunization status plus medical checkup chatlu habagi OPD ticket to store tora thambio habaneba. Aduga facility has established procedure for regular monitoring of infection control practices. Infection control monitoring si madi kanodadi amdadi yaudre antibiotic policies yaude. Next please. Committee you can talk the next next Cecil. Next next yes. Sigi periodic medical checkup and immunization of staff to. Sigi kano sineba ko record reviews never see the RR ko. Aduna next. Cecil next. Next. Okay. Sida tina important ni facility has defined and implemented procedure for ensuring and hygiene practices and antiseptic never. Aduna sigi kano sisu huzik standard precautions ki part amoina hand hygiene se yam thina maru oiba kano haitare every house koigi hospital staff sing se yamna oriento wa haitare si matang da adu adhere ju to honaba tawdaya de habdu ko. Next slide please. Aduna sida high say hand washing ME measurable element F21 the hand washing facility hand facilities are provided at point of use. Ado aina picturize to matamda OPD gi area dune immunization gi area dune OPD ne immunization area wa aduga koigi multitasking staff ki point of view at least ahum di dakata brain khalle ko hand the first hand washing practices the facility staff is trained in hand washing practices and they adhere to standard hand washing practices never si se kano su koigi training gi part amoina su kano na yawbuni training gi staff orientation gi matang da su ko aduga sigi measurable element F2.3 dana antisepsis haje assure standard practices and material for antisepsis adequate quantity da procurement gi su hangbra kan tawni sigi use of wise ko. Next slide please. Sidai sida neba WHO gi matungina clean your hand it saves life haibse sidabudi 11 git step ulle but mainly akona hand movements to record toragadi the importance say number 2 to number 7 neba sidi khoi matam matam phangwai matungina doubt le di tawna cross examine haitare assessment matamda natraga akoina hand holding la ko matamda hangogadaba pot haitare aduna si matangda ina request tawning base hojikti khara su hena orient toramani koina kaigumba peer assessment ataba as a hand holding la agadi checklist to hobudagi loibong nataba akoina hek doubt lay habadu hana discuss toroga nekta aduna akoigi preparedness amju daka taeba arm ki team kanona center du na ko aduga discussion hoba zero checklist number kano tagi hatare area of concern a dagi I spoke mathang mathang yeng panataba koi si tawre si doubt lay habdo mind toroga si phajana practice tawdragadi next slide please sisi sigi hand movement se kadabui maru oino haraga koina commonly hand watch tawr koina sigi hand movement se follow tawdragadi koi sida red ta piriba koigi between the finger webs kuma haitare natraga fingertips especially a large area of thumb je miss tawrineba aduga less frequently miss na blue colors neba na koina hand wash tawgadaba kadore hand movements to strictly adhere tawba takataiba next please aduga amu hand washing da mu hangbasi sum hangbagi hainaragana duration su hangbaneba habidi soap water use rogana min second kayano aduga kanona kayano alcohol based hand rub ABHR haise chamana 20 to 30 seconds ni alcohol based rub na soft na dugi double haitare 40 to 60 seconds aduna sigi 5 moments of hand hygiene sisu adum yam thin important ni aduga sisu muka hygiene sini phaba nataba tawra sum ningjang ba haitare sidai sida before ani yaubani after ahum neba aduna before ahum amadan aham before sina before touching the patient ko before patient contact haise number 1 se aduga before any aseptic or antiseptic procedures neba number 2 number 3 the 3 the remaining 3 jana after neba after touching the patient after touching the patient's surrounding and after body fluid risk exposure size dum isana hand hygiene taw matam da sum orai ba haitare ko si important ni next slide please yes the first standard F3 the facility ensures standard practices and material for personal protections habadi akoina tawninga su material to laitragadi compromise toroktoineba koigi kanojida infection prevention control da ana sisu amti important oba kanoni next slide please aduna sigi makhada measurable element da personal protection equipment the facility measurable element ni aduga koigi kano hatare means of verification dana facility ensures adequate PPE as per requirement neba na lay habdo duna adugi staff ti matugina number of staff ki matugina kano lay habdo personal protection practices facility staff adheres to standard personal protection practices neba ana kamai use tawge habdo kano su multitasking staff su koigi sa staff nurse su kamai use tawge to important hoiba next yes sigi picturization taw matamda koigi picture left to right chappa matamda ahumak se hospital staff ngataneba aduga hospital la ju thabak taw ngataneba but depending on where they work ko amana labor room da mali amana pharmacist mali amana multitasking staff moigi personal protective equipment singje loina hongi se aduna sigi matungina aduna personal protective equipments na covid matamda hana covid ki taw matamda siksu laisne aduda koina hana koigi pura full gown dang khalaga oiba simple marks mo upasisu koi protect tawbunina kaino neba personal protective equipments ki component amaneba right side the piri se koigi gown saur leire dagi googles leire dagi gloves leire masks leire duga glove boots haitare ko sin next slide please ꯁꯤꯗꯩꯁꯤꯗ ꯍꯧꯖꯤꯛꯁꯨ ꯗꯣꯅꯤꯡ ꯗꯣꯐꯤꯡ ꯍꯧꯖꯤꯛꯇꯅ ꯏꯆꯝ ꯆꯝꯅ ꯑꯩꯈꯣꯏꯅ ꯍꯪꯕ ꯃꯇꯝꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯒ꯭ꯂꯞꯁ ꯀꯃꯥꯏꯅ ꯎꯞꯀꯅꯤ ꯒ꯭ꯂꯞꯁ ꯀꯃꯥꯏꯅ ꯂꯧꯊꯣꯛꯀꯅꯤ ꯀꯦꯞ ꯀꯃꯥꯏꯅ ꯎꯞꯀꯅꯤ ꯀꯦꯞ ꯀꯃꯥꯏꯅ ꯂꯧꯊꯣꯛꯀꯅꯤ ꯃꯥꯛꯁ ꯀꯃꯥꯏꯅ ꯎꯞꯀꯅꯤ ꯀꯃꯥꯏꯅ ꯂꯧꯊꯣꯛꯀꯅꯤ ꯁꯤꯗꯩꯁꯤꯗ ꯗꯣꯅꯤꯡ ꯃꯇꯝꯗꯗꯤ ꯍꯧꯖꯤꯛ ꯃꯇꯨꯡ ꯏꯟꯅꯗꯤ ꯒꯥꯎꯟꯅ ꯅꯝꯕꯔ 1 ꯍꯦꯟ ꯋꯥꯁꯤꯡ ꯇꯧꯕꯤꯔꯅꯤ ꯗꯒꯤ alcohol based hand rub ꯇꯧꯔꯅꯤ ꯁꯤꯖꯤꯟꯅꯔꯅꯤ gown ꯎꯞꯄꯅꯤ mask upani Google upani last ta khwaidagi sterile logadaba gloves tuneba aduga doffing dana khwaidagi infected oiba potse hana doff tawduni lawthoktoineba mathangda gown ni Googles ni aduga khwaidagi akhoida protect tawriba mask sina last ta doff tawdoineba siju dum practice tawraga kano tawdoineba plus then hand washing duga alcohol based hand rub sijanabneba sumai tawdana gown gisu tungana lay mask gisu tungana lay ko gloves gisu tungana lay si dum practice tawbiba haitare ko next slide please yes see is a important way when personal protective equipment say availability and regular supply of PPE like gloves, gown, masks, head cap, shoe, lab coats, etc. Check staff is using this PPE when required. Check there is no reuse of disposable items. Never see yam tina strictly follow to godaba kano haitare points mayam haitare ko. Next slide please. F4 the facility has standard procedure for processing of equipments and instruments never. When everyday seasonary hospital seasonary instruments mayam do kamaina disinfect tawdoino kamaina sterilize tawdoino duga kamaina reuse tawdoino habagi takpa kano never standard never ko. Next slide please. Measurable element F1 decontamination and cleaning. The facility ensures that practices and materials of decontamination and cleaning of instrument and procedures areas ni standard practice used to have a ko. Aduga measurable element F4.2 disinfection and sterilization. Facility ensures standard practice and material for disinfection and sterilization of instruments and equipments neba. Aduna sidaisida di ahamba F4.1 gi decontamination and cleaning sta and hygienic base kamaina kari method season nai kamaina tauge habduneba koina sidaisida koina laktoise 3 bucket system dune aduga ka du kamaina clean tauge aduga kayam toina clean tauge adugi clean tawribado kamaina document tauge habduneba important orise ko aduga disinfection and sterilization dana tawriba potu koina kamaina register da maintain tauge habagi kenoneba yo kamaina ha kaniba points to ko next slide please yes sina kano gini decontamination gini ado kano di yamna di details di yaugde amgida dubu just koi kano khangau sis days da koina contact time ena yamna important use hang bane ko si contact time kaya no concentration kaya no hypochlorite ki se aduna any instrument ama use to base koina hana decontaminate tawbirani ma
John.
koina how
John maram thatke kenone CHO myam su yawi adagi PhD gi MO adagi consultant ke myam su khara yawi ado you can speak on what keno haitare ne
linguist
no gi su be or
PhD jo be ba okay yeah yeah
ni haitare
thank you aduna like decontamination da we always ask for contact time as well as the concentration never aduna magi can say important oil once you decontaminate it then you can clean with brush and detergent water and then you can send for sterilization never usually a common method the use to is autoclave ni details ta I biomedical waste ta matam da I habsarake plus high level disinfection never am used to is boiling boiling lead for 20 minutes never then you cool and dry and store never sigi can say do sigi say dom practice tawragadi masana adum lakaniba do khoina sum chacha bantamda potse dedicated staff amtang khangaga atai dikya aware oi the type layeba aduna knowledge se katang horizontally spread tawnabasu hona ba haitare everybody area at least the work torido I ideal haningeba ko next slide please okay so there is the high record say sterilization records being maintained in Hizabdo. What instrument and what sige the aduga autoclaving indicators are being used aduna akoina sidaisida usually commonly used to isidi chemical method ta signal lock use tawbuda ko aduga where are sterilized items kept na labor room da waragana khoigi usually aduna kanomda hangi mogi delivery sets kya lege kumaina ko aduga minor ot dana karai karai thambe usually minor ot dadi akoina high level this da boiling ne anama use tawse taga water na lagana IPD da lagana how lining is collected from wards whether some processing of infected lining done on patient care area sidai sida PHC gi dadi dirty linens thamnaba koina yellow bucket ama tungana dedicated thambaneba sidai sida ko aduga sigi kanu tusu ideal hen ba haitare concern staff in charge tusu ko sister in charge to ask staff how they do contamination cleaning of used instrument and procedure surface of like delivery and OT tables. Sina kanogi main di DH ne PH da kanatrokani. Tuga chlorine solution same bagi se. Kwa si yam tina dum hangle ba po ne ba. Tuga usually high level disinfection. Sidana karak ko use tok da bana koigi kya assessment la ko matam natraga koigi team gi meeting da si puthok pa yai ba ko. Ask OT staff about the processing, autoclaving, and management of sterile globes. Sidana DH ki anamba orani ko. Next slide, please. Yes, instruments ki cleaning ki da 6 recommended step for instrument processing neba. Ahamada huziki cleaning to budo infection kanolai re cleaning sida moina animak kanoto gre sida ko. Ahamba use of the clean tawre inspect tawre packaging tawraga sterilization the thabneba then store tawre aduga amuka delivery tawbneba then we assure quality assurance by using poche anini signal lock tuma important oil so that to make sure that autoclaving was done at the right temperature for the required duration ne one number two the once autoclave natraga sterilize tawrgasu adum thamba yadeba within 72 hours natraga 48 hours to 72 hours to use tawdabagi kanu su laibne aduna adugi kanu dusu khoigi practice su tawba aduga kanu dusu reflect tawba haitare khoigi document su ko next slide please. Yes simadi skip tawba yare kanu environmental control se sorry F5 se pra control tawra se si tawra oh sidai sidane sisil back tam ta handa view ne sorry sigi se three bucket system se sigi se yam thina important oi aduga khangba hai tare ko aduna ahamba bucket sidana water with detergent used in the beginning ne ba ahamba sida next na clean water ni tha tana disinfectant da usually kuina sum thijana kana tawda moina haise ethyl alcohol ju yai hypochlorite solution ju yai nataga lysol nataga phenol gumba use to hai tare ko so that magi do magi antimicrobial action do residue on le ho hai tare so that kanti no to ko na sigi concept si ju am clear obam dakatai next aduna okay sida layout ki matang sida kitang kana do unidirectional flow like them ne have do infected ka non infected ka mix to na ba no criss crossing do check for availability of clean solution and dispensing used for cleaning purposes one ni observe ko infectious patient are not admitted with other patient aduna isolation ward like ba ka tar ise kanogi primary health center gi CIC gi DH ki ko there is provision of equipment for maintain positive and negative pressure as per requirement. Sigi se kitang challenges lai na khanjai si jibokti tertiary hospital rims kumadadi modular hospital kari OT yam develop tawre si moi comply tawbra tawdabra adu important oi aina khanjai duga kai una kaino district hospital level bok tadi sigi se koi kano ne ba na tawdri ba implement tawdri haitare ko aduga external footways are not allowed in critical care areas like labor room ujikti labor room su laina re OT su laire adu ICU laina bajare district hospital di but at least in Canada di koina use ꯇꯧꯍꯟꯕꯁꯦ ꯂꯦꯕꯔ ꯔꯨꯝꯒ isolation ward kadi important oiba PAC level da ko do arm the labor room ask staff how they clean and disinfect the area see adum hanga da bani question se what materials they use for cleaning aduna kai use to ge do usually hypochlorite ona commonly use to male CHO mayam so dum feedback PBI ask staff how they manage spill especially of body fluids like blood ada aina sum thingnajabada kano sing se khoigi kano se ꯁꯤꯒꯨꯝꯕꯁꯦ ꯖꯁ ꯗꯦꯃꯣꯒꯤ ꯇꯥꯏꯞꯇ ꯊꯝꯕꯩ ꯇꯥꯏꯞꯇ ꯇꯧꯋꯦꯕ ꯑꯁꯦꯡꯕ ꯔꯤꯌꯦꯜ ꯁꯦꯅꯦꯔꯣꯗ ꯕ꯭ꯂꯗ ꯁ꯭ꯄ꯭ꯂꯤꯠ ꯂꯥꯛꯑꯀꯥꯟꯗ ꯂꯧꯊꯣꯛꯑꯒ ꯇꯧꯕ꯭ꯔꯥ ꯇꯧꯗꯕ꯭ꯔꯥ ꯍꯥꯏꯕꯁꯤꯁꯨ ꯆꯦꯛ ꯇꯧꯕ ꯃꯇꯝ ꯑꯃ ꯑꯣꯏꯔꯦ ꯁꯨꯝ ꯑꯩꯈꯣꯏꯅ ꯁꯨꯝ ꯊꯕꯛ ꯇꯧꯕꯒꯤ ꯗꯦ ꯇꯨ ꯗꯦ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯂꯩꯔꯛꯄ ꯃꯇꯝꯗ ꯍꯥꯏꯕꯗꯤ CHCꯗ ꯑꯣꯏꯔꯣ ꯑꯃ ꯑꯣꯏꯔꯣ ꯀꯤꯠꯇꯤ ꯂꯩꯗꯤ ꯂꯩꯕ ꯑꯗꯨꯒ ꯖꯁ ꯗꯦꯃꯣꯒꯤ ꯍꯥꯏꯇꯥꯔꯦ ꯇꯁꯦꯡꯕ ꯁ꯭ꯄꯤꯜ ꯇꯧꯔꯒ ꯂꯥꯛꯄ ꯃꯇꯝꯗ ꯂꯧꯊꯣꯛꯑꯒ ꯇꯧꯕ꯭ꯔꯥ ꯍꯥꯏꯕꯗꯣ ꯁꯤ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯑꯣꯏ aduga check for records for fumigation carbolization and cleaning activities sina kanogini especially labor rooms ko aduga minority gumba lairagana carbolization gi daga fumigation tawasisu koi ward su togali district hospital gidi PICD especially labor rooms kumada haitare ko where kano clean activities tawu phamje Cecil next slide please body spill management gi se tungana kano tawg aina haijabdo blood spill management se sida akoina khoigi required oiba PP oiro yellow bag leire googles leire adagi aina uzabda adagi spill kit ki kanoni part amani aduga changoi tha cautions tharaga changan adagi magi su large spill small spill khaidoga ko sigi kanone ba si se detail ana tungana lowna phado male next slide please si lakring mamangda standard F6 se lakring mamangda hujik se checklist ki matungina arm se natraga PSC se mercury free oiroina checklist ta palle ba ko aduna hujikti BP instrument to hujik mercury yaw daba kana taw hai aduda maina mercury fill oragadi full compliance phangni aduga free oramdraga kaigumba mercury waste management se fazana men demo tawbaga magadi half compliance 1 PO hai ba ko sigi kanoni aduda dumaina checklist maina duga last da khwaidi maru obisi sigi biomedical waste management ni sise ai CCC site se satlang chala matungda atopa slide amasu ai share tawjarake latest ni covid ki ju kitang yawi aduna mayam angtang fazana asi khangmina se haitare ko the biomedical waste management the facility has defined and established procedure for segregation see important term matani ko collection plus storage treatment and disposal of biomedical and hazardous waste neighbor. Next slide please aduna segregation se F6.1 segregation see at the point of generation neighbor. The facility ensures segregation of biomedical waste as per guidelines and on-site management of waste is carried out as per guideline neighbor. On-site management haibneba ko aduna aduga point of generation dasu segregate tawbiyo haibneba. SARF management the facility ensures management of SARF as per guidelines ai kona kana tawjarake fazana detail ta pajarake except mana haijari se pharmacy ga radiology yaw da bida atai department lo yaw haibneba aduga measurable ml F6.3 this the facility ensure transportation and disposal of waste as per guidelines hainebako aduna sidadi just heading the pbram details so we discuss dum tausi next slide please Cecil. Okay sidai sida amu haijai segregation tawbase point of generation da segregate tawbiu aduga khoigi dedicated khoina identify tawba kanoda buckets ta close buckets ta collect tawbiu close bucket ta transport tawbiu aduga store tawraga dispose tawgodamneba yaragadi common biomedical waste treatment facility oiba if it's less than 75 kilometers adu natragana khoigi health center du da no to dispose to bio habaneba next slide please ꯁꯤꯗ ꯈꯤꯇꯪ ꯀ꯭ꯔꯥꯎꯗꯦꯠ ꯑꯣꯏꯔꯦꯀꯣ ꯑꯩ ꯍꯣꯔꯦꯟ ꯁꯤꯗꯒꯤ ꯗꯤꯇꯦꯜꯁ ꯇꯧꯖꯔꯛꯀꯦ ꯍꯧꯖꯤꯛꯀꯤ ꯃꯇꯨꯡ ꯏꯟꯅꯗꯤ ꯁꯤꯗꯩꯁꯤꯗ ꯌꯦꯂꯣ ꯂꯩꯔꯤ ꯀꯣ ꯑꯗꯒꯤ ꯌꯦꯂꯣꯗꯅ ꯑꯩꯈꯣꯏꯅ ꯌꯨꯖꯨꯋꯦꯂꯤ ꯍ꯭ꯌꯨꯃꯦꯟ ꯑꯦꯅꯥꯇꯣꯃꯤꯀꯦꯜ ꯋꯦꯁꯅꯦꯕ ꯗꯤꯁꯄꯣꯁ ꯇꯧꯔꯤꯁꯦꯀꯣ ꯑꯗꯨꯅ ꯑꯦꯅꯤꯊꯤꯡ ꯕ꯭ꯂꯗ ꯁ꯭ꯇꯦꯟ ꯑꯣꯏꯒꯦꯔꯥ ꯄꯁ ꯁ꯭ꯇꯦꯟ ꯑꯣꯏꯒꯦꯔꯥ ꯑꯗꯒꯤ ꯄ꯭ꯂꯥꯁꯦꯟꯇꯥ ꯑꯣꯏꯒꯦꯔꯥ ꯅꯠꯇ꯭ꯔꯒ ꯀꯩꯅꯣꯅꯦ ꯕꯥꯏꯑꯣꯃꯦꯗꯤꯀꯦꯜ ꯌꯦꯂꯣꯗ ꯇꯧꯔꯤꯁꯦꯀꯣ ꯑꯗꯨꯒ ꯔꯦꯗꯇꯅ ꯑꯦꯅꯤ ꯑꯩꯈꯣꯏꯅ ꯇ꯭ꯌꯨꯕꯤꯡꯁ ꯍꯥꯏꯀꯣ ꯑꯥꯏ ꯚꯤ ꯐ꯭ꯂꯨꯏꯗꯁ ꯑꯣꯏꯕ ꯌꯥꯏ ꯐꯣꯂꯤꯁ ꯀꯦꯊꯦꯇꯔ ꯑꯣꯏꯕ ꯌꯥꯏ ꯑꯗꯒꯤ ꯕ꯭ꯂꯗ ꯕꯦꯒꯁ ꯀꯣ ꯑꯗꯒꯤ ꯕ꯭ꯂꯨꯗꯅ ꯁꯥꯔꯞꯁ ꯑꯦꯟ ꯃꯦꯇꯥꯂꯤꯛꯁꯅꯦꯕ ꯑꯗꯨꯒ ꯋꯥꯏꯠꯇꯅ ꯒ꯭ꯂꯥꯁꯋꯦꯌꯔ ꯑꯦꯟ ꯃꯦꯇꯥꯂꯤꯛꯁ ꯍꯥꯏꯕ ꯑꯗꯨꯒ ꯋꯥꯏꯠꯇꯅ ꯁꯥꯔꯞꯇꯨꯅꯦꯕꯀꯣ ꯅꯦꯛꯁ ꯁꯤꯁꯨ ꯑꯣꯜꯃꯣꯁ ꯁꯦꯝꯅꯤ ꯑꯩ ꯀꯩꯅꯣꯗ ꯐꯖꯅ ꯑꯦꯛꯁꯄ꯭ꯂꯦꯟ ꯇꯧꯖꯔꯛꯀꯦ ꯁꯤꯁꯦ ꯅꯦꯛꯁ ꯁ꯭ꯂꯥꯏ드 ꯄ꯭ꯂꯤꯖ ꯌꯦꯁ ꯁꯤꯒꯤꯁꯦ ꯁꯤꯗ ꯑꯝꯇ ꯈꯤꯇꯪ ꯕꯦꯛꯇ ꯆꯠꯄꯤꯌꯨꯕ ꯌꯦꯁ ꯁꯤꯒꯤ ꯀꯩꯅꯣꯁꯦ ꯄꯤꯛꯆꯔꯥꯏꯖꯦꯁꯟꯁꯦ ꯌꯥꯝ ꯀꯩꯅꯣ ꯍꯥꯏꯗꯤ ꯖꯁ ꯎꯍꯧꯕ ꯗꯔꯀꯥꯔ ꯇꯥꯏꯌꯦꯕ ꯍꯥꯏꯗꯤ ꯁꯤꯒꯤ ꯀꯩꯅꯣꯁꯦ ꯁꯤꯗꯩꯁꯤꯗ ꯌꯥꯝꯅ ꯐꯖꯅ ꯃꯦꯟꯇꯦꯟ ꯇꯧꯔꯤꯁꯦ ꯐꯥꯔꯁꯇ ꯁꯤꯒꯤ ꯀꯂꯔ ꯀꯣꯗꯦꯠ ꯕꯤꯟꯁꯦ ꯃꯥꯒꯤ ꯑꯦꯔꯤꯌꯥ ꯐꯖꯅ ꯁꯤꯀ꯭ꯌꯣꯔ ꯇꯧꯔ ꯂꯩꯔꯦ ꯀꯚꯔ ꯇꯧꯔ ꯂꯩꯔꯦ ꯑꯦꯟ ꯑꯒꯦꯟ ꯅꯝꯕꯔ ꯋꯥꯟ ꯑꯗꯒꯤ ꯈ꯭ꯋꯥꯏ ꯏꯝꯄꯣꯔꯇꯦꯟꯗꯤ ꯐꯨꯗ ꯑꯣꯄꯔꯦꯇꯦꯗꯅꯦꯕ ꯑꯗꯨꯅ ꯇꯆ ꯇꯧꯗꯕꯤꯗ ꯅꯦꯠꯂꯒ ꯂꯤꯠꯁꯦ ꯍꯥꯡꯗꯣꯛꯑꯒ ꯍꯥꯞꯄ ꯌꯥꯎꯗꯣꯏꯅꯦ ꯄ꯭ꯂꯁ ꯃꯥꯒꯤ ꯗꯦꯗꯤꯀꯦꯇꯦꯠ ꯀꯂꯔꯁꯦ ꯌꯦꯂꯣꯒꯤꯅ ꯌꯦꯂꯣ ꯄ꯭ꯂꯥꯁꯇꯤꯛ ꯕꯦग ꯌꯥꯎꯖꯔꯦ ꯔꯦꯗꯀꯤꯅ ꯔꯦꯗ ꯌꯦꯂꯣꯒꯤꯅ ꯌꯦꯂꯣ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯁꯤ ꯌꯥꯝ ꯊꯤꯅ ꯑꯥꯏꯗꯤꯌꯦꯜ ꯀꯩꯅꯣ ꯍꯥꯏꯇꯥꯔꯦ ꯗꯤꯁ ꯁꯨड ꯕꯤ ꯗ ꯋꯦ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯇꯨ ꯗꯨ ꯏꯠꯅꯦꯕ ꯅꯦꯛꯁ ꯁ꯭ꯂꯥꯏ드 ꯄ꯭ꯂꯤꯖ ꯑꯗꯨꯒ ꯁꯤꯗꯩꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯑꯃꯨꯛ ꯍꯥꯏꯖꯅꯤꯡꯕꯁꯤ ꯁꯤꯗꯩꯁꯤꯗ ꯗꯤꯁꯄ꯭ꯂꯦ ꯇꯧꯔꯒ ꯊꯝꯃꯤꯁꯦ ꯑꯗꯨꯅ ꯐꯥꯗꯕ ꯍꯥꯏꯇꯥꯔꯦ ꯇꯧꯔꯒ ꯁꯨꯝ ꯄꯣꯠꯁꯦ ꯍꯩꯔꯛꯄ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯑꯗꯨꯅ ꯃꯔꯛꯇꯗꯤ ꯍꯦꯛ ꯑꯩꯁꯤꯕꯨ ꯀꯩꯗ ꯍꯥꯞꯇꯣꯏꯅꯣ ꯆꯦꯛ ꯇꯧꯕꯀꯣ ꯑꯗꯨꯒ ꯃꯁꯥ ꯃꯇꯣꯟꯗ ꯑꯗꯨꯝ ꯂꯥꯛꯆꯍꯟꯕ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯍꯧꯖꯤꯛꯇꯤ ꯕ꯭ꯂꯦꯛꯁꯦ ꯌꯨꯁ ꯇꯧꯗ꯭ꯔꯕꯅꯤ ꯍꯧꯖꯤꯛ ꯔꯦꯗꯅꯦ ꯌꯦꯂꯣꯅꯦ ꯕ꯭ꯂꯨꯅꯦ ꯇ꯭ꯔꯥꯟꯁꯄꯦꯔꯦꯟꯅꯦꯕ ꯕꯥꯏꯑꯣꯃꯦꯗꯤꯀꯦꯜ ꯋꯦꯁꯀꯤꯗꯤꯀꯣ ꯑꯗꯨꯅ ꯏꯟꯁꯇ꯭ꯔꯛꯁꯟꯁꯦ ꯌꯥꯝ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯑꯣꯏ ꯑꯗꯨꯒ ꯑꯩꯅ ꯅꯤꯡꯁꯤꯡꯖꯕꯗ ꯍꯧꯖꯤꯛꯁꯦ ꯑꯩꯈꯣꯏꯁꯨ ꯏꯝꯄ꯭ꯂꯤꯃꯦꯟ ꯇꯧꯕ ꯈꯤꯇꯪ ꯀꯩꯅꯣ ꯇꯧꯗ꯭ꯔꯤ ꯁꯤꯒꯤ ꯗꯤꯁꯄ꯭ꯂꯦ ꯑꯣꯐ ꯏꯟꯁꯇ꯭ꯔꯛꯁꯟꯁꯦ ꯂꯣꯀꯦꯜ ꯂꯦꯡꯒ꯭ꯋꯦꯖꯇꯁꯨ ꯇꯧꯔꯣ ꯍꯥꯏꯔꯕꯅꯦꯕ ꯏꯪꯂꯤꯁꯇꯗ ꯅꯠꯇꯕꯤꯗ ꯀꯣ ꯅꯦꯛꯁ ꯁ꯭ꯂꯥꯏ드 ꯄ꯭ꯂꯤꯖ ꯌꯦꯁ ꯁꯥꯐ ꯋꯦꯁ ꯃꯦꯅꯦꯖꯃꯦꯟ ꯁꯤꯗꯩꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯄꯝꯆꯔ ꯄ꯭ꯔꯨꯞ ꯀꯟꯇꯦꯅꯔ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯁꯤꯒꯤ ꯀꯩꯅꯣꯁꯦ ꯁꯤꯗꯩꯁꯤꯗ ꯋꯥꯠ ꯑꯦꯚꯔ ꯁꯥꯔꯐ ꯀꯣ ꯁꯔꯖꯤꯀꯦꯜ ꯕ꯭ꯂꯦꯗ ꯑꯣꯏꯒꯦꯔꯥ ꯅꯤꯗꯜ ꯑꯣꯏꯒꯦꯔꯥ ꯑꯗꯨꯒ ꯑꯗꯨꯒꯤ ꯀꯩꯅꯣ ꯍꯥꯞꯐꯝꯅꯦ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯁꯤꯗꯩꯁꯤꯗ ꯃꯣꯏꯅ ꯌꯨꯖ꯭ꯋꯦꯂꯤ ꯍꯥꯞꯄꯤꯁꯤ ꯏꯟꯁꯨꯂꯤꯟ ꯁꯤꯔꯤꯟꯁ ꯌꯥꯎꯔꯦ ꯑꯗꯒꯤ ꯅꯤꯗꯜ ꯌꯥꯎꯔꯦ ꯑꯗꯒꯤ ꯁ꯭ꯀꯥꯜꯄꯦꯜ ꯕ꯭ꯂꯦꯗ ꯌꯥꯎꯔꯦ ꯀꯣ ꯑꯦꯅꯤ ꯁꯥꯔꯐ ꯏꯟꯁꯇ꯭ꯔꯨꯃꯦꯟ ꯁꯨड ꯕꯤ scalpel blades lance scissors needles aluminum foil and any container contain contaminated sharp objects neba sida haptoise next slide please blue sinane khoigi glassware broken and contaminated glassware medicine vials and ampoules neba sigi kano sida blue color sida sigi se details ta ai mukka present tawjarak sake next okay liquid waste management si akoina sigi se especially lab natraga labor room da use to ko dispose to base akoina general waste da dispose to dring da we make a temporary container haitare where we treat the infected liquid with kanone hypochlorite solution aduga dedicated time ama thamakanda discard to haitare so that it can be mixed neba ꯑꯗꯨꯕꯨ ꯗꯦ ꯇꯨ ꯗꯦꯗꯗꯤ ꯁꯤ ꯆꯦꯂꯦꯟꯖꯦꯁ ꯑꯗꯨꯝ ꯂꯩ ꯍꯥꯏꯕꯗꯤ ꯌꯥꯝꯅ ꯕꯦꯟꯀꯨꯝꯕ ꯌꯥꯝ ꯂꯩꯔꯒꯗꯤ ꯀꯩꯅꯣꯗꯣ ꯂꯣꯒꯤꯡ ꯌꯥꯝ ꯊꯣꯛꯄ ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏꯅ ꯃꯊꯛꯇ ꯁꯤꯐ ꯑꯃ ꯁꯇ꯭ꯔꯦꯟ ꯇꯧꯅꯕꯁꯨ ꯁꯤꯖꯤꯟꯅꯩ ꯄ꯭ꯂꯁ ꯁ꯭ꯇꯥꯐꯀꯤ ꯌꯥꯝꯅ ꯗꯦꯗꯤꯀꯦꯇꯦꯗꯂꯤ ꯌꯨꯁ ꯇꯧꯕꯁꯨ ꯗꯔꯀꯥꯔ ꯇꯥꯏ ꯀꯣ ꯑꯩꯈꯣꯏꯅ ꯂꯩꯔꯤꯈꯤꯇꯪ ꯁꯤꯖꯤꯟꯅꯕ ꯑꯩꯈꯣꯏ ꯆꯠꯈ꯭ꯔꯒꯅ ꯑꯗꯨꯝ ꯑꯗꯨꯁꯨ ꯆꯦꯂꯦꯟꯖ ꯑꯃꯅꯦꯕꯀꯣ ꯅꯦꯛꯁ ꯁ꯭ꯂꯥꯏ드 ꯄ꯭ꯂꯤꯖ ꯌꯦꯁ Sideshida, it's very cannot away. Things to be learned from this picture is that it is transported in a closed container. with the staff in full PPE neba. Dedicated haidi multitasking staff ki gumboots ne, aduga gown namane, aduga masks ne, cape ne season arga ko. It is carrying on this trolley, and it should be done where there should be patient care area lagi away ogdam neba. Next slide, please. Dedicated storage for biomedical waste ni. Aduga sida hand washing point amsu laiba haitare. When you dispose of, then you can wash your hands never ko. Should be away, and aduga it should be such a place that the collecting van could directly come to that point never. Lakpa yaba, thungba yaba, mafam da laigadaba neba. Next slide, please. Yes, this is the Koigi Memorandum of Understanding Koigina Common Biomedical Waste Treatment Facility Sizaga link Laibagi. Sidesa Inamu Panzaning Basi. Now they are talking about barcodes, number one. Aduga Inamu Kitang Kona challenges faced over say. Procurement of non-chlorinated bags say. This is another challenge never. PHC level bokti I'm not sure, but CHC ga DH level the D CC akuina koigi dedicated website developer like the developer ga upload the kata eba yearly gi wena ko, so that canon eba CG canon. Next slide. Yes. Kaigumba koina CBW FTF the ko common biomedical waste treatment facility the P bangam dragadi, we can use deep burial pit with appropriate from the appropriate authority neba. Aduna Manipur Pollution Control Board tagi we get authorization haitare to do this neba. Waste being belonging to category 1 to 3 collected in yellow container are disposed by this method neba. Next slide, please. Needle stick and sharp injury. See, is very important neba. This is something koigi kanoda tip talagadamni aksi matangda koigi nako gi team koi district ta haigana dako haitareko nestek as control kanodo organization gi mogi koi dafko have dako gi kanona fazana si fazana gyan ta hoba da kataiba aduga post exposure prophylaxis ki karaida phangani karaida kanada laini kanada contact togdoni. This is very important neba. Otherwise koina wari tabada sister in charge haitareko sida koigi multitasking staff se waste management jo phajana maintain torom daba matam handling jo phajana tak daba matam post exposure prophylaxis matam khang daba matam da koigi staff ama HIV su hepatitis B su C su loina positive oiba laigreba aduna du thoktanaba sigi kano si matang sida amna phajana khangau ba daga taiba needle stick and sharp injury plus management haitareko aduna safe management of soft needles where personnel sina how to avoid neba to management na encourage the wound to bleed ideally by holding it in current water aduna squeeze tawganu aduga don't squeeze or suck the blood from the wound haise don't say scrub the affected side, report the injury to the supervisor infection control nurse aduga ideally akoigi kanoda usually CIC da leranggodawo male PP gi kanose aduda natana hepatitis B gisu kobinu usually koina post exposure prophylaxis haraga HIV ngatang khalleba hepatitis B is important oiba duna hepatitis B gi vaccination immunoglobulins P gi matang da ko hojikti hepatitis B vaccine kanogi hepatitis B gi phajana program it has come lae so we have a nodal officer adun contact toroga adum phangani ba posting se immediately consult doctors on emergency duty find out patients HIV hep B and hep C status C is important oi aduga usually kaigumba second party oragadi amadusu khudakta tawada ka taiba kaigino harkanda magi baseline hujikta lawrakani habna taba magi baseline kaida lay do hek ma positive oire haga ko na khangbudo na taba huji hek prick tong matam da magi baseline gi status kamai lay haga da test of usu ya not only the kano the patients ki na taba ko treat First dose of PPPRO should be administered ideally within 2 hours and within at the most 72 hours neighbor of exposure and evaluated as soon as possible. Aduna high risk exposure, low risk exposure, aduga source criteria, exposure criteria haina tungana sisu lay. Sigisu tungana amtang akoi district ta dum orient tawbada ka taba panoma ne bako. District hospital gedi tawe but district yo ne tawbada ka taba. Next slide please. Yes, mercury spill management gido. Zikidi hazi harization mercury spill kidi mercury free orba amdo full mark pire. Kaigumba mercury free oramdre spill management fazana haibire the partial compliance pangani bako. Next, I think it's over. Last. Ah, thank you. Safety level bokta any doubt leradi amtang haibiu. Cecil. Cecil.
Oh, sir.
Oh, I amaga ne share torke bako PPT amaga. Adu amtang share toro.
Yay, thazabiro.
Ko. Any doubt leradi haibiro.
John.
Yes.
Misali na kanogi ama staff mayam loina mag periodic check-up tawbagi do.
Yearly.
Yearly check-up tawbagi do. Adu akoi gido I am not sure kamo practice tawge do. Adu just file nama tawraga. Adu ka suppose periodic check-up tawge ase mainly infectious diseases king yato oidoine bako.
Yes.
Adu me typhoid kuba kitang tawraga yadoiro. That you are like the infectious disease in the na.
Usually OPD gi ticket ama tawredna ko kano.
I didn't know nada di something nada di aduga mu casual leave kumbalogo me am should nare ko em to doing ba. Ado practically adu kamaina to doing odo.
Poche kano ne ko sakti ay agan sorry. Trusty na gyan tazab ni hajara age bako. Sigi health checkup se ani thona khai dueba food handlers to. Kitchen de handle to ba group tu gina oziki typhoid adu hepatitis A adugi wari lak tu ne bako. Sigi general health checkup haragadi magi kano duneba. Any adi OPD chalaga my complaint toroga magi mandatory general checkup haitare health checkup haitare.
This is
Kaigumba kitchen gi oragadi kitchen gi handler organa tungana ma chatkre. Hojiki typhoid enteric dumaina khaidokna chungudra khale.
Example kita hai ko kita oi tare na mandatory ama su like grocery bo like to ba malin kun ai di gi staff mayam gi magi annual checkup ki ai di just kano tham annual checkup ki record tham ga tabani kot ka dabni na lai tabani na ne
aga checklist ta yaw bune kano checklist ta yaw bune
adu simi ko to na ba ai na thengna ba amo bo thengna ba adu gini
Madam, I thana kanamtang haija horage. Sigi ani oidoi ko amana immunization of staff ki amana health checkup of staff ki ada yam tuba koi ki format kumba kai gumba na taba koi ki general physical checkup hai tare mai OPD physics sir na hai biri ba OPD ki ticket amaka aga magi vitals mayam ma loba magi RBS hepatitis B C retro adugumba gi details to mahapa ga ma se generally physically fit oibra oidabra habitu gi just chi amamam kai gumba staff tra mari lai raga di chi tra mari aduga magi register amada all magi staff mayam je hepatitis B gi immunization ga TT gi immunization ga tobra habagi record to lai di adum compliant oirana aduga physical akoigi hai akoigi atai yam akoigi advanced oiba natabida magi general vitals tuga adi known case atopa kano laibra disease laibra aduga magi test akoigi chumna gi test BCR gumba dagi akoigi physically fit oibagi akoina certificate pibada changba adugumba khara dagi magi blood group gumba adumba hapiragadi dum just chi ama khak thambiraga loire file ama semaga staff mayam dugi amamam
ai adu di suppose specially adi aina sum ujabagi ko aina sum thengna jabada ne ꯁꯤꯁꯦ ꯄ꯭ꯔꯦꯛꯇꯤꯁꯁꯦ ꯈꯔ ꯍꯥꯏꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯈꯔ ꯕꯨꯁꯞ ꯇꯧꯕꯒꯤꯕꯨꯗꯤ ꯗꯔꯀꯥꯔ ꯂꯩꯔꯦꯀꯣ ꯑꯗꯨꯗꯤ ꯍꯧꯖꯤꯛꯀꯤ ꯑꯣꯏꯅꯗꯤ NQAS ꯇꯥꯔꯒꯦꯇꯦꯠ ꯃꯌꯥꯝꯗꯨꯗꯤ ꯃꯦꯟꯗꯦꯇꯔꯤꯗꯤ ꯊꯝꯃꯣ ꯍꯥꯏꯇꯥꯕꯅꯦꯕ ꯃꯣꯏ ꯁ꯭ꯇꯥꯐ ꯃꯌꯥꯝ
Yes, adu kanuneba trustee kanogi wa natabako. Mark phangbai wa natabako.
ꯍꯣꯏ ꯑꯗꯨꯕꯨꯗꯤ
Nate mark pai jai haijirakebako.
ꯑꯥ
Chahi do 30, 40, 50 yausalagadi ma do routine di screen tauragadi mangonda lakadaba hypertension ogera diabetes ogera poto khangaktoineba. Mark su phangni adu su khangaktoinebako. Aduna kanomdo oina sensitize taubiba haitare.
ꯍꯣꯏ ꯍꯣꯏ
Aidi ai haijai ni taugadaba mi di tauwe tauroidabadi ko as khangdre ai haijai. Hidak leite hoji.
ꯑꯧ ꯁꯤꯁꯦ ꯑꯗꯨꯅꯦ ꯑꯩꯁꯨ ꯑꯗꯨꯝ ꯈꯜꯂꯤꯁꯦ
Ane moida admaina sensitize taubiba haitare. Adi samna habda hoji aina sum amda zabda unabase Assam di leramani ko area dugi. Ko Assam leramani multitasking leramani pharmacist leramani ko ANM leramani ado CHO ka ko. Si composition neba. Aduda adum akhoi at risk for diabetes hypertension adum yaudorabane sigise aduna as a part of katare program gi su part amoina adagi moisu part amoina adum check up tok tok pa su kaideba used to haitare
ꯐꯥꯎꯗꯤ ꯌꯥꯝ ꯐꯕꯅꯦ
advaina sensitize to haitare ko
thank you
okay okay
doctor I amma question hange
ꯑꯩ ꯑꯃꯇ ꯍꯪꯖꯒꯦꯕ sorry Kara.
Once sterilized tawbasi numit kya tamba yabra
within 72 hours aina ningsang badako 72 hours if it's not used then we again have to sterilize again.
Yes 72 thank you
kainomta hangzageba sisi biomedical waste ki area ama yawkhibani na ne mate khatang mari leinatabra di khangde kainomta hangjage doubt sisi doctor na khumgadabra adu natraga state ki site gi oigadabra di khangde ko aduga akhoi gi kaino sida biomedical waste ki da annual report submission aina ama he yawrieba aduda aina na hamu sigi area si state ta su hangjakhrabani sigi area si amu kharo hona leibadawna taweba PHC level da su district hospital gi da su adu do sisi karmai tawraga kamai tawne
kanone harimla ai site gi khumage CHC ga district hospital di am clear cut oina leibako aduga kaigino haigadi sigi biomedical waste se dedicated website to the upload to hena guidelines piribako aduna CIC ga DIS ka di maintain taweba adu dum liquid kya generate tawi patient kya yenki solid waste kya generate tawki blood sample kya tawki loina leiba data ko CIC bok leini kan khange ai PHC ga arm ga di I am not sure ne
PHC ga arm ga se PHC level da su leitabadong taweba aduda aina he hangjabada na hamusu hangrabane ba adu CC mogi level da CC kamain tawraga kamain tawgadabano aido amta haibiu
sigi se kanoni singbadi kanoga huziki kaigumba poche ani ni PHC da kaigumba CPW amogi si akhoi context di CG hospital haireko sigi se moina laurei si weight ki basis ta paisa ji lauri neba lowi ko hello harimala hello
tai
do weight ki matungina moina bill sembane ba ko weight ki matungina magi bill sembani adu do documentation neba poche adu bu kaigumba akoina khoigi on health center da manage tawragadi adugi kano do weight to all aganda sumaina generate tawe habagi monthly natraga yearly da dum thokpa yaba pot neba thoksu thokom thoeba adu kaigno da lairagadi yam laire akhoi aina haijai kaigumba sizaga contact tawa mafam gi yam laire ba kaino da moina bill semaktoise measured weight to matungina amount of waste generated matungina moina rate semai neba adugi moigi case me mola kani dana aduda check tawda thola ni
okay aduga akhoi gi data entry tawbadudadi handak ama macha ama di hapa idana ꯑꯅꯧꯕ ꯑꯣꯏꯅ ꯍꯥꯄꯛꯄꯅꯦꯕ ꯑꯗꯨ ꯋꯦꯠ ꯀꯌꯥ ꯑꯣꯜꯂꯒ ꯏꯚꯟ ꯁꯕ ꯁꯦꯟꯇꯔ ꯂꯦꯚꯦꯜꯗꯐꯧ ꯑꯗꯨ ꯀꯌꯥ ꯃꯣꯏ ꯋꯦꯠ ꯖꯦꯅꯦꯔꯦꯠ ꯇꯧꯏ ꯍꯥꯏꯕꯗꯨꯒꯤ ꯑꯗꯨꯕꯨꯗꯤ ꯑꯣꯜꯂꯒꯕꯨꯗꯤ ꯑꯗꯨ ꯑꯦꯟꯇ꯭ꯔꯤ ꯇꯧꯍꯜꯂꯦꯕ ꯑꯗꯨꯒ ꯁꯤꯒꯤ ꯔꯤꯄꯣꯔꯇꯤꯡꯒꯤ ꯔꯤꯄꯣꯔꯠ ꯁꯕꯃꯤꯁꯟ ꯍꯥꯏꯕꯒꯤ ꯄꯣꯠꯁꯦ ꯁꯤꯗ ꯈꯔ ꯗꯥꯎꯠ ꯂꯩꯕ ꯍꯥꯏꯇꯥꯔꯦ
ꯀꯩꯅꯣꯗꯅꯦ ꯔꯤꯄꯣꯔꯠ ꯁꯕꯃꯤꯁꯟꯁꯦ ꯍꯧꯖꯤꯛꯁꯦ ꯀꯩꯅꯣꯒꯤ ꯑꯣꯏꯅꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯋꯦꯕꯁꯥꯏꯠꯇ ꯑꯣꯏꯅ ꯑꯞꯂꯣꯗ ꯇꯧꯋꯦꯕꯀꯣ ꯗꯤꯁꯇ꯭ꯔꯤꯛ ꯍꯣꯁꯄꯤꯇꯥꯜꯒ CHCꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅꯀꯣ ꯑꯗꯨꯕꯨ PHCꯒ ꯃꯈꯥꯗꯗꯤ ꯁꯤꯒꯤ ꯋꯦꯕꯁꯥꯏꯠꯀꯤ ꯀꯩꯅꯣꯁꯤꯗꯤ ꯌꯥꯎꯗꯕꯅꯤꯅ ꯕꯠ ꯑꯩꯅ ꯑꯃꯨꯛꯀ ꯍꯥꯏꯖꯩꯁꯦ ꯀꯩꯒꯨꯝꯕ PHCꯗꯣ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯤꯖꯒ ꯀꯟꯇꯦꯛ ꯂꯩꯔꯒꯗꯤ ꯃꯥꯒꯤꯗꯤ ꯌꯥꯝ ꯀ꯭ꯂꯤꯌꯔ ꯀꯠ ꯑꯣꯏꯅ ꯏꯌꯔꯂꯤꯗ ꯅꯠꯇ꯭ꯔꯒ ꯃꯟꯊꯂꯤꯗ ꯖꯦꯅꯦꯔꯦꯠ ꯇꯧꯕꯗꯣ ꯑꯗꯨꯝ ꯎꯠꯄ ꯌꯥꯅꯤꯕ ꯕꯠ ꯀꯅꯥꯗ ꯔꯤꯄꯣꯔꯠ ꯇꯧꯗꯣꯏꯅꯣ ꯍꯥꯏꯕꯗꯨꯗꯤ ꯑꯩ ꯒꯥꯏꯗꯂꯥꯏꯟꯁꯇꯤ ꯑꯃꯨꯛꯇꯪꯒ ꯀꯩꯅꯣ ꯇꯧꯕ ꯗꯔꯀꯥꯔ ꯇꯥꯏ PHCꯒꯤ ꯀꯩꯅꯣ ꯇꯧꯕꯗꯤ ARMꯒꯤꯁꯨ ꯌꯥꯎꯗꯦꯗ ARMꯒꯤ ꯀꯩꯅꯣ ꯇꯧꯕ ꯖꯦꯅꯦꯔꯦꯁꯟꯗ ꯆꯦꯛ ꯂꯤꯁꯇ ꯑꯩꯅ ꯆꯦꯛ ꯇꯧꯕꯗ
ꯅꯠꯇꯦ ꯑꯩꯅ ꯍꯥꯏꯖꯩꯁꯤ
ꯁꯔꯅ ꯍꯥꯏꯕꯤꯔꯤꯁꯤꯅꯦꯕꯀꯣ ꯗꯤꯁꯇ꯭ꯔꯤꯛ ꯍꯣꯁꯄꯤꯇꯥꯜꯒ ꯃꯔꯛ ꯊꯠꯅ ꯑꯩ ꯁꯔ ꯀꯩꯅꯣꯝꯇ ꯁꯄ꯭ꯂꯤꯃꯦꯟ ꯇꯧꯖꯒꯦꯀꯣ
ꯍꯥꯏꯕꯤꯌꯨ
ꯀꯩꯅꯣꯅꯦ ꯑꯩꯈꯣꯏꯒꯤ PHCꯒꯤ ꯗꯤꯁꯇ꯭ꯔꯤꯛ ꯍꯣꯁꯄꯤꯇꯥꯜꯒꯤ ꯂꯦꯚꯦꯜꯒ CHCꯒꯤ ꯂꯦꯚꯦꯜꯒꯗ ꯉꯁꯥꯏꯒꯤ ꯋꯦꯕꯁꯥꯏꯠ
ꯍꯜꯂꯣ ꯁꯤꯁꯤꯜ ꯇꯥꯗ꯭ꯔꯦ ꯍꯜꯂꯣ ꯍꯜꯂꯣ
ꯑꯄꯣꯝꯕ ꯃꯔꯨꯞꯀꯤ ꯁꯣꯛꯄ ꯃꯇꯝꯗꯗꯤ ꯅ꯭ꯌꯨꯔꯣꯒꯤ ꯗꯣꯛꯇꯔꯁꯤꯅ ꯑꯩꯈꯣꯏꯁꯦ ꯅꯦꯠꯄꯗ
ꯍꯜꯂꯣ
ꯀꯩꯅꯣ ꯍꯥꯏꯕꯗꯤ ꯅꯦꯠꯄꯣꯁꯤꯗꯤ ꯀꯤꯅꯤꯒꯤ ꯈꯪꯒꯦꯗꯅ
ꯁꯤꯁꯤꯜ
ꯅꯦꯠꯄꯣꯁꯦ
ꯁꯤꯁꯤꯜ Cecil Cecil
Cecil'de kolanda mala ekranında.
Hello Cecil taagidre Mate Cecil do taagidre ai kouda
Hello
Tare
ꯀꯩꯅꯣꯁꯦ ꯇꯥꯗ꯭ꯔꯕ꯭ꯔꯥ
tare Cecil tare
ꯇꯥꯏꯀꯣ ꯑꯩꯁꯦ ꯇꯠꯈ꯭ꯔ ꯃꯥꯜꯂꯦ ꯈꯣꯟꯁꯦ ꯑꯣ ꯑꯗꯨꯅ ꯑꯩꯅ ꯍꯥꯏꯖꯅꯤꯡꯉꯤꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯦꯛꯆꯨअली ꯅꯍꯥꯟꯋꯥꯏ ꯀꯃꯟ ꯕꯥꯏꯑꯣꯃꯦꯗꯤꯀꯦꯜ ꯋꯦꯁ ꯇ꯭ꯔꯤꯠꯃꯦꯟ ꯐꯦꯁꯤलिꯇꯤ ꯂꯩꯇ꯭ꯔꯤꯉꯩꯗꯗꯤ ꯐꯦꯁꯤलिꯇꯤ ꯏꯟꯗꯤꯕꯤꯖꯨꯋꯦꯜ ꯐꯦꯁꯤलिꯇꯤ ꯈꯨꯗꯤꯡꯃꯛꯅ ꯁ꯭ꯇꯦꯠ ꯄꯣꯂꯨꯁꯟ ꯀꯟꯇ꯭ꯔꯣꯜ ꯕꯣꯔꯗꯇ ꯔꯤꯄꯣꯔꯠ ꯊꯥꯕ ꯑꯃ ꯅꯤꯠ ꯑꯣꯏꯔꯝꯃꯦꯕꯀꯣ ꯕꯠ ꯍꯧꯖꯤꯛꯇꯤ ꯄꯣꯂꯨꯁꯟ ꯀꯟꯇ꯭ꯔꯣꯜ ꯕꯣꯔꯗꯇ ꯊꯥꯔꯤꯕ ꯔꯤꯄꯣꯔꯠꯁꯦ ꯁꯤꯖꯅ ꯊꯥꯒꯗꯧꯅꯦꯕ ꯑꯗꯨꯅ ꯁꯤꯖꯒ ꯇꯥꯏꯞ ꯇꯧꯕ ꯐꯦꯁꯤꯂꯤꯇꯤꯁꯤꯡ ꯁ꯭ꯇꯦꯠ ꯄꯣꯂꯨꯁꯟ ꯀꯟꯇ꯭ꯔꯣꯜ ꯕꯣꯔꯗꯇ ꯔꯤꯄꯣꯔꯠ ꯊꯥꯕꯒꯤ ꯅꯤꯠꯁꯦ ꯑꯣꯏꯗꯦꯕ ꯑꯗꯨꯕꯨ ꯑꯩꯈꯣꯏꯅ NQASꯀꯤ ꯆꯦꯛꯂꯤꯁꯇ ꯊꯥꯕ ꯅꯤꯠ ꯑꯣꯏ ꯍꯥꯏꯇꯥꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯔꯤꯄꯣꯔꯠ ꯑꯃ ꯆꯦ ꯑꯃ ꯑꯩꯈꯣꯏꯒꯤ ꯆꯍꯤꯗ ꯑꯩꯈꯣꯏ ꯕꯥꯏꯑꯣꯃꯦꯗꯤꯀꯦꯜ ꯋꯦꯁꯀꯤ ꯔꯦꯖꯤꯁꯇꯔꯗꯤ ꯃꯦꯟꯇꯦꯟ ꯇꯧꯕꯅꯤꯅ PHCꯒꯤ ꯂꯦꯚꯦꯜꯅ ꯍꯥꯏꯇꯥꯔꯦꯀோ PHCꯒꯤ ꯂꯦꯚꯦꯜꯅ ꯃꯥꯒꯤ ꯀꯩꯅꯣꯁꯤꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯁ꯭ꯇꯦꯠ ꯄꯣꯂꯨꯁꯟ ꯀꯟꯇ꯭ꯔꯣꯜ ꯕꯣꯔꯗꯇ ꯆꯦ ꯑꯃ ꯏꯕꯤꯕ ꯌꯥꯏ ꯀꯣꯄꯤ ꯇꯨ ꯗꯥꯏꯔꯦꯛꯇꯔ ꯄꯤꯌꯣꯅ ꯍꯥꯏꯕꯁꯨ ꯌꯥꯏ ꯄꯤꯗ꯭ꯔꯒꯁꯨ ꯀꯩꯁꯨ ꯀꯥꯏꯗꯦ ꯁꯝꯇꯥꯏꯝꯁ ꯗꯥꯏꯔꯦꯛꯇꯔꯒꯤ ꯂꯦꯚꯦꯜꯗꯒꯤꯁꯨ ꯁꯤꯒꯤ ꯃꯦꯗꯤꯀꯦꯜ ꯋꯦꯁ ꯔꯤꯄꯣꯔꯠꯁꯦ ꯁꯤꯛ ꯇꯧꯕ ꯌꯥꯎꯋꯦꯕ ꯑꯗꯨꯅ ꯀꯣꯄꯤ ꯇꯨ ꯗꯥꯏꯔꯦꯛꯇꯔꯗ ꯄꯤꯕ ꯑꯃ ꯀꯩꯁꯨ ꯀꯥꯏꯗꯦ ꯕꯠ ꯑꯦꯛꯆꯨअल ꯔꯤꯄꯣꯔꯠ ꯁꯕꯃꯤꯁꯟꯁꯤꯗꯤ ꯁ꯭ꯇꯦꯠ ꯄꯣꯂꯨꯁꯟ ꯀꯟꯇ꯭ꯔꯣꯜ ꯕꯣꯔꯗꯇ ꯑꯣꯏꯗꯣꯏꯅꯤ ꯑꯗꯨꯒ ꯏꯐ ꯐꯦꯁꯤꯂꯤꯇꯤ ꯑꯃ 75 ꯀꯤꯂꯣꯃꯤꯇꯔꯁ ꯑꯦꯟ ꯑꯕꯞꯇ ꯑꯣꯏꯔꯕ ꯕꯥꯏꯑꯣꯃꯦꯗꯤꯀꯦꯜ ꯋꯦꯁꯁꯦ ꯃꯣꯏꯒꯤ ꯂꯦꯚꯦꯜꯗ ꯗꯤꯁꯄꯣꯖ ꯇꯧꯖꯕ ꯑꯣꯏꯇꯥꯔꯒꯗꯤ ꯃꯣꯏ ꯑꯦꯅꯨꯋꯦꯜ ꯃꯣꯏꯒꯤ ꯖꯦꯅꯦꯔꯦꯁꯟꯁꯦ ꯀꯩꯅꯣꯗ ꯁ꯭ꯇꯦꯠ ꯄꯣꯂꯨꯁꯟ ꯀꯟꯇ꯭ꯔꯣल ꯕꯣꯔꯗꯇ ꯄꯤꯕ ꯑꯃ ꯆꯪꯉꯦꯕ ꯁꯤꯅ ꯄ꯭ꯔꯥꯏꯃꯥꯔꯤ ꯍꯦꯜꯊ ꯁꯦꯟꯇꯔꯁꯀꯤ ꯑꯗꯨꯒ ꯁꯕ ꯁꯦꯟꯇꯔꯒꯤ ꯂꯦꯚꯦꯜꯗꯗꯤ ꯍꯧꯖꯤꯛ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯅꯧꯕ ꯏꯟꯁꯇ꯭ꯔꯛꯁꯟꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯃꯣꯏꯒꯤ ꯌꯥꯝꯅ ꯖꯦꯅꯦꯔꯦꯠ ꯇꯧꯕ ꯅꯠꯇꯕꯅꯤꯅ ꯃꯣꯏꯒꯤ ꯂꯤꯡꯛ ꯄ꯭ꯔꯥꯏꯃꯥꯔꯤ ꯍꯦꯜꯊ ꯁꯦꯟꯇꯔꯁꯤꯡꯗꯨꯅ ꯍꯦꯟꯗꯜ ꯇꯧꯍꯜꯂꯨ ꯍꯥꯏꯕ ꯑꯃ ꯂꯩꯕꯅꯤꯅ ꯔꯤꯄꯣꯔꯠꯁ ꯄ꯭ꯔꯥꯏꯃꯥꯔꯤ ꯍꯦꯜꯊ ꯁꯦꯟꯇꯔꯁꯤꯡ ꯄꯤꯔꯤꯕ ꯔꯤꯄꯣꯔꯠꯇꯨꯅ ꯑꯗꯨꯝ ꯀ꯭ꯂꯥꯏꯟꯠ ꯑꯣꯏꯅꯦꯕ aduga kainosidi magi primary health center gidi 75 kilometers and above oiragadi mandatory oire 75 kilometers yaudragadi sije da piriba potuna adum yare aduga sub center gidi chahi magi generation se hujikti amuk sub center gi IWC gi han arm portal du da hujik anobo yaurabanina adudagi dum haidi kaigumba khoina regularly adudai du da maintain tawtaragadi even akhoi register leitraba hu yarne adudagi dum khangme Thank you.
I Dr. Devina, you can tarungi.
Haibiyo.
Oh, how keno waste generation gi report ha base. Keno da di amadi HMIS ta monthly report amadi thai.
Monthly report ama thai ba.
Oh, HMIS ta magi part ama yawi buka.
Okay, adugi report sina. Yes. Adugi HMIS ki report sina akhoi ki health ki manung da dum lai ghrane ba. Hujiki do hoi ngasai HMIS ki report ta thaba hai se akhoi ki arm gi portal da su hujik se every akhoi ki kanu khuding ki monthly akhoi ki generation se kyam laige na digital da adu da su ha pa bane ba ko but adugi happy se adu thai di yad because for thaba hai si de akhoi na state pollution control board ta thaba gi report sina report oidoi ne ba adu bu ngasai
adu na annually thaba khoi na mo hujiki dun
hujiki state pollution control board ne annually tha doini dana aduga HMIS ki duna monthly oidoi ba monthly HMIS report ta generation se yaw doini ado akoina monthly HMIS ki report ta khoi gi kano gi disposal gi record hap pa se akoina adugi report tu na di report thai hai ba yada ba because akoina repari ba tools to the state pollution control board oi ga dong ne HMIS di gi health ki manungi wa oi ba aduduna if akoina kano je report thai hai taragadi state pollution control board ta
ado NQAS tadi sigi je kano report thai na puthopadi yaroidora ba adudi
HMIS chira
agende still aina hygienic base checklist to the khogi means of verification do adu exactly kai ige have do adu comply to guna chungani ba
adu iroi daba state pollution aduga akhoi ki biomedical waste ki keno se report annual report thabra na haneba aduga health bra adu adi pandaba neba
adu do kano dane adu gi akhoi gi NSSRC haitara na regional do moidasu adang katare the well defined to binaba haitare ko
nataba sigi akhoi ki biomedical waste management rules 2016 se sida report thana na ba annexure ma yauri se to the state pollution board never
okay
aduna always biomedical waste management biomedical waste ki report se to the state pollution control board adu biomedical treatment facility later agadi all reports are supposed to be sent by the common biomedical waste treatment facility
okay hello Oh, Cecile. Hello, Cecile.
Sir.
Makata yarbo.
Yeah, sir. Slide se upirabra.
Ure, ID ure. Mayam urabzala.
Next hadum haipiro aduga dum chase.
Sina latest akhoi sisu khoi kano dagi state quality assurance unit na pibirakuni just aina appropriate way na si kitang detail way na pinaba latest to haitare ko sina. Then a pictorial guide on biomedical waste management rule 2016 aduga amendment in 2018 and 19 never which include the central pollution control board guidelines for handling treatment and disposal of waste generated during treatment diagnosis and COVID-19 gisu yauna minister of puneva. Next slide please. Aduna every line say there is a focus of view Keep hospitals clean and safe by Keep hospitals clean and safe by identifying hazards and risks of biomedical waste never. Sigi matungina place the waste in designated color coded bins. One, depending on the type of waste, we segregate in yellow, red, blue, and transparent puncture proof container. I will come in details neba. As of now, black is gone. Yellow ne, red ne, blue ne, transparent puncture proof container ne lid oiba. Next slide, please. General waste we have again divided into three neba. Black hazardous and other waste. Aduga recyclable waste, biodegradable waste. Sina general waste. So black, blue, and green. Next slide. Aduga next slide, please. Aduga rules when followed protect our health and safety neba. Sida haise aduna kaigumba yellow sina akoina back of the mind that say incineration the chatui neba. Whatever is yellow, it should be burned neba in a dedicated area. Duga yellow na red na for treatment neba. And give your biomedical waste to CBWTF for complete treatment and disposal as per biomedical waste rules 2016 neba. Next slide, please. Manage biomedical waste per rules per biomedical waste rules ni aduga segregate waste in correct color liners non chlorinated haise on exact magi area da blue dana sharps ka metal ga aduga red dana ziki khigi kano se blood bags tubings red dana anatomical waste aduga general waste se see details tam lakhini ko. Next slide, please. See, the segregation is easy never, and it should be done at source. I say it's very never. Wherever it is generated, it is source never. Aduna kuina water it should be available never, so that commoner or a patient attendant or su adumakta dispose to bayanaba. Tuga akoi healthcare worker da su disposal da easy oina bahai tare ko. Next slide, please. Duga Sigise. Segregate waste in correct liners for suitable treatment neba. Aduna yam tina important oeba. Karai da kari haptuno aduna akoina sum thingnazabasi sometimes ko yam toina budinate koigi bakke pudi laiba aduga plastic bag se heta phangdabagi red su yellow hapsan ba ko blue da su yellow hapsan ba upai laitabagi haitare bag to wat pagi ko admain thing nei adu do yarigai encourage to bidaba haitare kitang crowded oi mathangda fazana detail da explain tawjarakke asengbadi ai sigi slide tai haning base black ki waste se general waste se sida akuna usually tawnai se e waste ko thambagi adagi CFL blood kumba sigi si collect tawnaba kanu neba ya hazardous waste ki kanu neba duga koina use of batteries ko si sida tawnaba thamnaba ba kanu haitare bakke bin haitare ko. Next slide, please. Aduna never mix waste during collection and transportation. Haise. Cecil, go ahead. Cecil, aduna sidai sida moina taurise. Sidagi color wait. Color sida yellow bag sidagi yellow bin dagi yellow kana thola ineba. Yellow plastic bag. Red tagi red plastic bag thola ineba, and they are not mixed neba. During transport also duga during collection also. See am important oi natragadi handlers the confusion thoga yamna katare yamna source of danger never. Next slide, please. Aduga manage spillage right away haise right time this toba aduna chemical spillage na sumain to haise isolate neutralize and clean thoroughly aduga yellow dong chatkani blood fluid spillage especially kano de kogi blood ni haitare ko sida su isolate toba duga mop with absorbent clothes or paper and disinfect appropriately sisu yellow tauba duga next na sarf kineba is a slide full screen je udaba kana fit to original size wait ko okay aduna sarf ki orgadi kana to ba haitare mercury spillage ki neba sinamo ko ana whatever waste akoi hujiki especially akoi setting da di body fluid spillage ka chemical spillage nani mercury di almost free oidor bane ko next slide please treatment and disposal options for blue category waste at C akoi common biological waste ne natraga common treatment facilities ne ba aduna koina glassware ga metallic waste si treat taw matamda either it goes to the CB akoi common biological waste treatment facility natraga akoi on center da captive treatment facility da chatani chatlagan matungda hujik se either option se cleaning with detergent and water ko aduga double kano season ba haitare double bucket season ba ko duga koigi blue kano da season blue cartoon box to blue color ne ba or koi common biological waste to organa koina sidaisa autoclaving natraga microwave season ba or for disinfecting sterilizing waste na sterilize see either we are using autoclave natraga microwave ne ba next slide please Cecil next slide sidana akoina waste sarf se season kanda koigi common biological waste organa dry heat treatment taweba natraga autoclave tawbama natraga koigi kano dawena kano organa koigi on center treatment facility organa autoclave natraga for sterilization season haiba ko duga sigi sidaisida moina koina kitang challenging थोपसी सार्प टूबदी कोई कनो तौदे सेंटर तौदे होरेन कनो दा रेट आई हाइजरके नेक्स्ट स्लाइड प्लीज रेट खिजा सिजिल नेक्स्ट रेट सिदा अखोइना जिदा उरिसे सिरिंज दा प्लंजर गा सिलिंडर दुने अदगी ग्लव्स ने अदगी ब्लड बैग्स ने बोतल ने ट्यूबिंग्स ने बा ना रेड बैग्स दा हापगा इधर common biological waste treatment ni aduga sidaisida for sterilization waste neba duga CFT organa sidaisida microwave neba da koina guidelines ki matungina sigi se kaigumba tubing se oragadi sidaisida mu panjal palami se straight or mutilate to have neba or ko antanga biu ko straight or mutilate to have neba autoclave tor matungda or combination for sterilization and shredding ni and send for authorized recycling for energy kanoneba do guidelines ki matungina akoi da su health center da su point of generation da su sigumba tubings kuma se autoclave troga straight troga pbo habeneba but kitang akoi gi autoclave se kanon leitabagi haitare kitang si se kitang comply oba kitang wa le haitare next yellow dana zikse koi human anatomical waste ne natraga kano any blood soak cotton ore ko aduga sidaisida kano pisu koigi personal protective equipments uppase sisu dispose tore aduga moina jikta orisina either go for sterilization or microwave to dune ko aduga next ne sisil kitang kanore kano phone size duna sidaisida ina hijabado autoclave kido autoclave ta moina makhal ani thona pirameba for vacuum autoclave habaga gravity flow autoclave habaga almost kanodi manari ni ziki temperature je 121 degree and pressure da 15 pounds per square inch for an autoclave resident time of not less than 45 minutes neba. Or kegumba temperature je wangana 135 wargana pressure su 35 per pound square inch for an autoclave residence of not less than 30 minutes neba. Gravity wargasi chap manai 15 pounds ni aduga 60 minutes oiba hana 45 oibedo aduga 30 oibeduna 45 minutes oiba kaigumba yang wanga di no less than 149 oragadi 52 pounds per square inch oragadi 30 for not less than 30 minutes neba aduna type of autoclave tasu depend toroga pressure ga temperature ga duration kene hai tare ko next slide please aduga sidaisida haijaning masi ai sidaisida kitang the operator of common biomedical waste treatment facility shall transport the biomedical waste from hospital only in vehicles having level as provided in Part A of the Schedule 4 along with necessary information as specified in Part B of Schedule 4. Tharaga chatpadune moina pamise comply to honingise hujiki kanoda sijagi dadum yawbune kana torokanda. Next. Okay. Safety first, protect gears for healthcare workers neba. See, I'm important oi. Sida aina area of working matungina, I may be wearing only the mask, or I may be only wearing the mask and say gloves, or the more infectious waragana gowns su, boots su, gloves su, mask su, Google su, adagi face shield su, mask su sizinaba yaiba. Depending on where we work, we customize haitare ko. But it is a must for our own safety haitare. Next. Sida koina if we don't regulate our biomedical waste ko, it risks our environment as well as our health. Not only our staff kinatana koigi koida visit tawla iba patient as well as patient attendant haitare ko. Careless handling of waste can lead to spread of infection disease such as hepatitis, AIDS, and tuberculosis. Aduga kano haitare sidagi infection acquired from hospital do. Koina kana to kanda. Duna general waste ta kamain lakeda sigi pictorial da ningjan base general waste we usually give to kano neba municipality neba. But if we put our biomedical waste there, it can also infect those staff neba. Duna usually biomedical kano se the municipality gi kano sina yamna they used to react very badly neba when this doesn't happen properly. Next slide. Yes. If injured, treat your wound immediately neba. Aduga do's and don'ts to. Squeeze tawganu, scrub tawganu, suck tawganu habdo. Don't clean with alcohol. Encourage the wound to bleed by holding it under running water. Wash the wound using running water and plenty of soap. Dress the wound after drying it and seek urgent medical advice neba. Aduna whether PEP chagadra, charoidra, follow up comment tawdino habido achigi decision logudab neba ko. Next. Aduga koina haidoise never drag the dedicated trolley ama dum thamba haitare. Never drag fill waste linens never ko. Waste should never be handled without wearing protective gears. Next slide. Yes. Sige se. Sida pictorial the misto ise yani kano se. Sige pictorial the ul ise koi hospital da generator ise 70% si general waste neba. Aduga only remaining 30% sina kano neba biomedical waste neba. So it is important to segregate general waste from infectious biomedical waste as mixing of this can lead to greater spread of infections and epidemics neba. Only 25 to 30% sina loimak contaminate tawragadi waste do loimak handlers tagi attendants tagi loina at risk ta thamani bako. Next slide please. Waste management COVID-19 wards could be sample collection centers and laboratories say. Oh. Sisil sidi kitang chak thon biro. Sidai sida Hana Sudum Toba Gidi Ningzang Amgani, Quina, any waste generated COVID Tomatamda record maintain Tawi, Aduga Kanatawi, Aduga Sigi opening of operation of COVID-19 isolation ward sample collection center C Sidabudi State Pollution Control Board Pigadabne High, but Adudagi Adumatamduda di Quina Quigi dedicated state Quigi waste management dang manage tauba koigi nodal officer lay aduga paw phonaraga manage taukhibneba adagi collection by should be stored separately in temporary storage room prior to handing over the authorized neba aduna matamda su pot se ani thona mu khaidorok pa haitare covid habaga non covid habaga aduna covid ki tungana collection lakba duga general waste kina adu atopana tungana laksagi ba haitare ko duga sigi se there is the only dedicated trolleys with COVID-19 labels to be used never. Sida hari se. Many can also use to we aduga koi plastic bag when I use of the su dum Thai COVID te ko. Biomedical waste should be segregated as per the CDS same ni, but only thing is when a plastic bag any seasonable do cannot to bahitare. Follow to be bahitare. The inner and outer surface of the container trolley waste should be disinfected with 1% sodium hypochlorite solution daily. Sigi disinfect tawagi. Yare. Next, kono. Duna sidai ako na kamaina kono tawno especially yellow bags tene yamna kono taw ise aduga double layered obi bako sigi kano se double layered plastic bags haitare ko si season abiba aduga dedicated magi bin collection laiba aduga area collection ju laiba aduga koigi common CBWD gi team ga pau phajana phauna ba haitare next almost lower bani Cecil next okay thank you questions
Doctor, I should question ka hagge.
Suppose
ukol the masi CRC 75 kilometer ngaktin na ko isi 18 na lakpo ngamdre. Suppose madu the white say ko karma laire subpit yellow na di burial pit laire red ka blue say karamay phone ngene.
Disposed of ira. Okay.
Red na
red ka asing badi aduda di akoina sharp pit maintain to budo
sharp pit ka di barrel di taway bako
sharp pit di akoina needles kumba do use to widana ko
hoy
aduda aina understand to zabada akoina kaigumba sigi pose kamaina lakya kanda when akoina area of choose to matam da ko haidi akoina kaigumba hospital expand to ningba matam sida natraga dedicated line up to kan moi adu le ramagadi yamna difficult oigi baduna magi side of selection je si yamna kano to haninge haitare ko yamna katare very yam thought over to haninge but just kano gi ngahak kina tabako because akoina covid matam da isolation ward ki approach road semak pa matam da hana adu mafam do sapit orambagi yamna dai do yam wag yaba ziki kano to kanda aduga another means kanosina anything say should never be burning say should never be encouraged never
mother suppose burning say if not increase already incinerator like the kamay to gane
mane adugi kanosima
madu everyday red sisho recycle chalo hai bako agenda
yes
recycle hai the recycle the agent ko like tabdin na so it hilly it's very common problem
I can supplement to jage bako
yes Still tadre.
Just get it. Okay. Red is a akwai huziki habi do yam chumi hilly area da yam commonly faced of problem ni yellow do di burial pit thada grani sharps to na nasai keno da thada grani sharp waist pin da thada grani red se mutilate to maru red se contaminated ti oidoi ni ma IV fluid ki tube ba ma gi IV fluid kumba dumba oidoi ni moise 1% or 2% hypochlorite solution da 30% akhoi achoba jar amada ko bright achoba amada hypochlorite solution se to ma sagi concentration se phajana happy raga 30 minutes se phajana disinfect tawbiro ba ko adugi poto wash tawbiraga municipality da dum pbo ba general adi kai gumba pura phajana disinfect tawro matung da ne general waste ki type da oina if recycler itragadi pibo municipality natraga general waste oina
maduga doctor karma blue di kram hai tawgani
blue
glass kumba
blue su chama nei bako glass vials ko kai gumba se glass khoi gi kan sharp bin da dum hape ai ko sharp mayam dudi ampoules sing se ampoules mayam se sagi sharp waste bin da dum haptan bi go bako sharp oi da sing vials sing do adugi pot tu di pasan disinfect to biro ba kano da 1% hypochlorite solution da 30 minutes ting kanda wash to biro aduga kano da koi ngasai gi blue koi gi cardboard amada hapa kanda adusu municipality da PBO ba if
municipality thank you
municipality na su if everything decontaminated oitaragadi moi lobone ba do
thank you yam nungai doctor masi confuse alaiba ko
aduga siga konana ai kenomtanga mayam da haizarange bako ngasai blood akhoi any biomedical waste ki karam ba pu no pre treatment to doino haibase akhoi keno dadi biomedical waste rules semak matam dadi loina maki semak pane duga akhoi NQAS ki oina di sub center ki level da pre treatment to doise glass ki vial do oye bako yam kanna practical oibadi oide but sub center ki level da mandatory pre treatment to gadosina glass ki vial se adagi PHC ki level dadi ngasai red adagi metal sharp su adi syringe ku akhoi ki keno gumba needle gumba sharp metallic sharps mayam se aduga red su si mayam se loina keno tau haeba akhoi ki pre treatment tau haeba ko aduga lab ki oina di syringe to ngasai ki double bin tau bodo perforated bin namaga hapado lab tadi syringe su magi leiriba akoina aduda sizinariba glass ki slide kumba kai gumba mayam se loina mak pre treatment tau ba changi hypochlorite solution na treatment tau tar 30 minutes 1% to na 30 minutes ba ama treatment tau bagi guideline oi aduga anything related to TB oiraba sputum yaubo oi taragadi phenolic compound 5% phenol sina 8 hours haidi overnight kumba adumaina tingona haibagi guidelines se oiba aduna lab ki part ki biomedical waste ki ngasai ki disposal se kitang different oi nasana han haijabal adumaina 5% phenolic compound na 8 hours tingba oidoiba contact time se aduga chumnagi PHC UPHC ki laboratory sida syringe kumba glass slides kumba sugumba tingdoisina 1 or 2% hypochlorite 10 minutes aduga glass bhai dudi no the tingo haide PHC gi level dadi tingo haide but sub center gi oina di glass bhai sing jo 1% or 2% hypochlorite the ting ba amma need oeba ko according to checklist thank you
doctor karma amaga hika hange suppose karma external gi film gi digital mombo hiki digital di lakre mombo laktraga da digital oidraga my film gi kesa mahi do
X-ray developer
madu gi karma da PO hai boko suppose madu ba pininga later di karma madu gi dispose di karma tawgani
dispose to se adu targadi common biological waste treatment facility da pidaba yaro yedede
haibidi maduda paisa bi generate tawo hebako madubo suppose agent do phangdadi
any akhoi ki jewelry ki shop laitabra local jewelry shop
laibidi amani bidi ubidi u
amuk tang approach to bio jewelry shop na low bane sing bai shu
Oh, jewelry shop ta ko.
Jewelry shop se jewelry shop moi ki gold silver to ba kangbu do moi atum low bane.
Oh. Maduga aina kha confuse up. Maduga drug ki expert dispose se amutang nang haibiramone.
Expired medicine se
Hoi
expired
hoi.
medicine se yellow bin da hapakanda pigadoiba kaigumba yellow bin akhoi kano laitagadi common biomedical waste treatment facility laida taragadi ani thokna layebako common biomedical waste treatment facility da pigadauba oiragadi makhum kaika loin yaura pigineba deep burial pit ta haptoiba oitaragadi nang kano do lokthokkan
Mahido lo thogadabda. Oh.
मागी स्ट्रिप कई दो लौथोकबदी बरे द हापतो अरगदी अगा कॉमन बायोमेडिकल वेस्ट ट्रीटमेंट फैसिलिटी लिंक तौबो ओइतारगदी एज सच अदुम पीगिनेबा
Oh, thank you, thank you. Yam nung
कई गुम्बा अखोई मैन्युफैक्चरर द नत्रगना अखोई द सप्लाई तौ मफम दुदा हनबा याद्रगदी डिस्पोज तौदोइनिको एनी एक्सपायर्ड मेडिसिन्स कई गुम्बा अखोई प्रोसीजर लैरबा अखोई हन to the manufacturer hangiba yabagi possibility lairagadi aduduna ihan hana adopt tawbini kaigumba adugi return tawbagi policy se lairagadi koina burial ngasai dispose gi either cbtwf without magi thugaida bida aduga deep burial pit thugairaga mine.
Oh, thank you. Yam nungai doctor.
Over to you, sir.
Dr. John do tat krama male.
Oh yeah, so chakpega.
Loishallashe. Question hangdamo kay hango, hangoido organa question halse.
John, Dr. John ngai ngai da less critical lomda kitang mayam CHO kaino sum mayam yawi ado koi hangjaningi se koi ki dustbin da kasi color bag to hai tare ne ko bag to leina ba yawbra kamai tauge sizinadabra sizinaragadi kaidagi lake government na pirakpra isana leijabra lekaloira mayam tabibra hello
Sub center की थी क्या तो हेलो
plastic hajiki bin da hapna plastic bag keno do adu kamai tauge ba
अखोई सब सेंटर की थी एएम की कनो की थी ले जाइए बा कोई ना कोई ना
lejaye ba state na
हाँ
pirak
तेना पिरक को दो याद दे तुझे बाउंडे
okay okay atopa PHC ki staff yaw singsta am hangjage PHC ki kamai tau ya anyone from PHC hajiki koi ki biomedical waste bin gi plastic to ado state ki pirakpra na ta isana lejabra kamai tau ram ta habiyo I can see PHC kurkul dai khara yaw male
PHC kurkul gi sana dum lei jai state gi pirak padi
sana
sare
amta u piraktriba
am to pirak
okay okay I just wanted to note because we have some fun about BMW kitang support tawna ba yam badi nate district yam ye adagi almost more than 400 health center lay ko aduna kyam ngam gadoino di khangde adu khangning ba haitare aduna yaragadi koi ki site isu piba gadra adu isu khanba haitare aduna PHC ki su masana leijayeba amta pirakpa yaudriyeba
yaudri
okay adagi anyone from CAC and district hospital in this group yaudama malika CAC ka bude anyway Dr. John changang tramale yadramale no to phone to
Hello.
John tabra
Ay, changang na bukan honor ye.
oh yeah you can start you are audible now
Kay matang no.
nate nagi kaino to loigraba natro loiraba
Loy gay.
anything to discuss
Adane moy QA do moy hang lo ba sing ang ri party.
question khara low se ba we puk ahom ta
THO gi any dog lay badi ran to holo.
okay I was just talking about kainoni da haziki bindu da hab da plastic to adu yam important oi banina haziki aina hazik CHO kangu PHC kangu da hangbada di masana leijay na haiba ado district hospital Bishnupur gi di kamai tawge adu so masana dum leijabra ꯈꯪꯕ꯭ꯔꯥ ꯇꯥꯕ꯭ꯔꯣ ꯖꯣꯟ ꯑꯃꯨꯛ ꯇꯣꯠꯈ꯭ꯔ ꯃꯥꯜꯂꯦ
Lorsalaria también así de verdad. Kayaknya noni, dojo saja le dohnya bro. Legal. Nang pesado tapo ta. Ngasi hayeng hangsit ka yara roi. Paisa leite mi nang bo karino mathang ke mu yore haba. Mathang tawbu tawdaba hayeng kapo. Hayeng irai ni da hayeng kapo. Nang loibado nang si ay nangonday lupa chawnga lawidadi yaroi huje. Nangonday.
Hayeng irai hayeng pesa kapake hay do noin okta tobiyo.
Hayeng
Samsung se mi rum da tobiyo
nang hayeng kapo ko. Nang ngarang kapo ke hayeng kapo ke yung. Nang marup tawraga talo tho mai tawradi. Migi bit hat pathabag ni nang toido. Ay yung matong munang marup ka hujara roi khalo. Nagay tawdo naman. Wanang di ba sa kontra kang di kapo ko. Hindi mo rin ito po ko no sa may ni punjala. Hindi na si ay di ay dami. Ay jale mo lang ko ni. Po kam ta lai po ti ko. Sa la da bane ko ju kula ro sa me ji last ai na sang ho ni hospital je noi lo chak ta ga. Ai lui chala ai ni sai. Ama mo je ko mo. Si doi register me apni ko dai sa ge. Poro si pu do ni yunda. Ma mo ki em mo ba. Ko ka. De jam de iti. Ngồi lắm anh.
Manoranjan. Hello. Cecil. Cecil.
Cecil, question
Tabra.
si chu ma'am di question letragadi kano tawsalone. Samabam tawsalaga losengai tawsini.
Mane. Hꯧꯖꯤꯛꯀꯤ ꯀꯩꯅꯣꯗꯣ ꯑꯩꯅ ꯀꯩꯅꯣꯝꯇ ꯍꯥꯏꯖꯅꯤꯡꯕ ꯕꯦꯛꯇꯣ ꯍꯜꯂꯣ ꯇꯥꯕꯤꯕ꯭ꯔꯥ ꯍꯜꯂꯣ
ꯖꯣꯟ ꯇꯥꯕ꯭ꯔꯥ
ꯇꯥꯏꯌꯦ ꯑꯩ ꯇꯥꯕ꯭ꯔꯥꯕ
John, you are not
ꯇꯥꯏꯌꯦ ꯑꯩ
audible.
ꯇꯥꯏꯌꯦꯕ ꯑꯩꯃ
Hello?
ꯍꯜꯂꯣ ꯑꯩꯗꯤ ꯇꯥꯏꯌꯦ ꯅꯪ ꯇꯥꯗꯕ꯭ꯔꯣꯕ
Oh, tare. I am mute the word.
ꯑꯣꯀꯦ
So we can took.
Kainomta haizage ba? Sir. Hello?
John, are you still there? Tatkrama male. Habiyo.
Sir.
Habiro.
Masagi kainogi dustbin ki bag ki do.
Hmm.
Ado supply tawrakani khara pibirakani haibdo pirakta di medium gi size to ina pibiro achawbadi leiba dum phange ba ko aduga macha di leiba yam wai phangde ba.
Oh, medium size ta.
Okay.
Ado budi mai gi kaino du matum district hospital CAC gumudi moi masa masa gi kara su kaino leibani na ko. We not be yam kanna
Akwai amdadi ayambana medium do in sizinai.
ꯑꯗꯨ ꯁꯕ ꯁꯦꯟꯇꯔꯒ ꯄꯤ ꯑꯩꯆ ꯁꯤꯒꯨꯝꯕꯒꯤ ꯈꯜꯂꯒ ꯑꯣꯏꯅ ꯍꯥꯏꯗꯤ ꯖꯦꯅꯦꯔꯦꯁꯟꯁꯨ ꯌꯥꯝꯗꯦꯗꯅ ꯑꯗꯨꯅ ꯃꯦꯗꯤꯌꯝ ꯁꯥꯏꯖꯇꯨꯅ ꯑꯗꯨꯝ ꯌꯦꯡꯉꯒꯦ ꯑꯗꯨꯃ ꯌꯦꯡꯒꯦ ꯑꯗꯨꯒ ꯑꯇꯣꯞꯄ ꯖꯣꯟꯗ ꯑꯃꯨꯛ ꯊꯣꯛꯈ꯭ꯔꯕ ꯖꯣꯟ ꯑꯥꯔ ꯌꯨ ꯁ꯭ꯇꯤꯜ ꯗꯦꯌꯔ ꯑꯃꯨꯛ ꯇꯠꯈ꯭ꯔꯕ ꯃꯥꯜꯂꯦ ꯃꯥꯁꯦ anyway thank you all for joining in Koigi, sorry for the inconveniences regarding using the digital IT ma'am kano to experience oiba the bakra gi kara kano oiba su yaure so John amuk change John tabra we'll take some one or two questions and we'll wind up then. Are you still there, John? You are not audible. Problem. Anyway, let's wind up for today. We'll come back with a different topic next week. Thank you all. So let's wind up.
Thank you.
Nang nalatra ay di hybrid nang nandiyan.
Okay, mute thambada yadra. Phone anoubanina yam haitriba.